Malaysia is facing growing pressure to impose tougher lockdown rules as COVID-19 infections there surge. And more than 6,000 new cases have been added. That's a new daily record. Nearly half of them are in Selangor. Melissa Go with this report.
Selangor, the richest state in Malaysia, is feeling the heat after consecutively posting record numbers the past week. Now, this has prompted the opposition-controlled state government to defend itself. It's doing all it can, it says, to support the Federal Health Ministry in executing government policies.
Selangor tertinggi. Jadi seolah-olah semua beban itu diletakkan atas kerajaan di Selangor. Saya nak mengatakan bahawa bidang kuasa ini kita kena faham. Ya, bidang kuasa kerajaan di Selangor dalam isu kesihatan adalah complementary.
Although the mass testing in Selangor could have contributed to the rise in new cases, the state government wants the federal authority to step up contact tracing and vaccination. Now, both have been slow, they said. But Vaccines Minister Khairi Jamaluddin promised that the rollout of the national immunization program will speed up come June and July when bulk of the vaccine supply comes in.
The rate that we vaccinate people will increase. It increases in June, it increases in July, it increases in August. And with the rate that we are projecting, I am confident that we can finish by this year.
And Malaysia has ordered enough vaccines for 80% of its population. Now, so far, only Pfizer, AstraZeneca and Sinovac are approved for use. Now, the government, he said, through voluntary opt-in program for AstraZeneca vaccines this month, has driven up the vaccination rate in the country. Now, almost 8% of the population have received their first dose. Now, to achieve some form of herd immunity, Malaysia needs to vaccinate more than 150,000 people a day by June onwards. Now, the public healthcare system is stretched to the max, with almost all the ICU beds taken up in the Klang Valley. Now, patients, according to frontliners, are getting younger, and some didn't have fever or cough or lose their sense of smell or taste. Now, the Health Director General, Dr. Nur Hisham, has raised concerns that the new variants are harder to treat, and when patients deteriorate, it's fast and sudden. Now, more than 200 have died the past week, and the death toll in the country has exceeded 2,000. Now, frontliners have been working on double shifts, and many are worn out. Now, this has prompted the Health Director General to urge Malaysians to exercise self-discipline and stay at home. Now, health experts have called for full lockdown, including all the malls and workplaces, in a bid to flatten the curve and buy time for the system to rebuild the buffers. Melissa Go, CNA, Kuala Lumpur.